Small intestine 15 is located 2 cm lateral to the inferior border of C7. Locate your C7. Use the medial border of the spine of scapula to dictate your 3 cm mark. Move out 2 cm to find this point. Bladder 2 is located in a depression at the medial aspect of the eyebrow. Palpate along the supraorbital margin until you locate a nice dip at the medial end of the eyebrow. That's your bladder 2. Bladder 4 is located half a cm into the anterior hairline, 1/3 of the distance from do24 to stomach 8. Bladder 4. Bladder 8 is located 5.5 cm into the anterior hairline, 1.5 cm lateral to the midline. The easiest way to find bladder 8 is to find bladder 7 and then move posteriorly by 1.5 cm. Bladder 9 is located 1.3 cm lateral to do17. Remember that it's 4.5 cm from the posterior midline to the mastoid process, and use this to help work out your 1.3 cm to find bladder 9. Do17 is on the posterior midline. It's 1/4 of the distance between do16 and do20. Do17 is 1.5 cm superior to do16, but more importantly, it's in a nice depression at the superior border of the external occipital protuberance. Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 cm posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other do points, so don't be tempted to go further back than 1 cm posterior to that midpoint. Do23 is located on the anterior midline, 1 cm posterior to the anterior hairline. We take the distance between the centre of the glabella and the anterior hairline as being 3 cm, so divide this into 3 to get your 1 cm to move back to locate Do23. Do25 is on the anterior midline at the very tip of the nose. Gallbladder 14 is located above the pupil looking directly forwards, 1 cm superior to the eyebrow. To locate this point you need to stand directly in front of the person, have them look forwards. Remember the distance from the centre of the glabella to the anterior hairline is 3 cm, which would enable you to calculate your 1 cm. You can locate this point in a dip that's formed when the brow starts to come away from the skull. Gallbladder 16 is located on a curved line joining gallbladder 15 to gallbladder 20. It's 1/3 of the distance from gallbladder 15 to gallbladder 18, which is on a level with do 20. This makes this your gallbladder 16. Stomach 4 is located 4 fen lateral to the corner of the mouth. It's in the nasolabial groove. Have the person smile and you can see this point falls nicely into that groove. Stomach 8 is located directly superior to stomach 6 and stomach 7. So run your finger up in a line from stomach 6 and stomach 7, projecting up onto the corner of the head until you're in a nice depression just superior to the temporalis muscle.
Pericardium 2 is 2 cm inferior to the anterior axillary crease, in between the 2 heads of biceps brachii. If you pinch the muscle up either side and put your finger in between the 2 heads, that will be where pericardium 2 is. Large intestine 2 is on the radial aspect of the index finger. It's just distal to the second metacarpal joint. It's much better to locate this point with the fingers loosely flexed. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine points are best located with the arm resting against the abdomen. Large intestine 6 is 3 cm proximal to large intestine 5 on a line going to large intestine 11. What's important about finding this point is that if you think of the arm as being a box, large intestine 5 would be on the top of the box, large intestine 7 would be on the side of the box, but large intestine 6 would be on the corner. Gallbladder 37 is located 5 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point.